You are listening to the Marketing 32 Show with your host, Brett Allen.
Hi, Brett Allen here, host of the Marketing 32 Show, where I connect with leading dentists, dental influencers, and industry experts to uncover the latest and greatest, to provide you guys the insights and innovations and strategies to help your dental practice grow and thrive. As always, our episode here is brought to you by our team at Marketing 32. We are the only dental marketing team that I know of with a performance guarantee that if you're not growing and we can't prove that impact for your practice, then you don't pay us. So we're truly invested in who we work with. We've helped over 260 practices now across the US, Canada, and Australia. If you need help with growth, if you need help with marketing, reach out to us at marketing32.com. Quick shout out to Marissa and Chris from the Dental Practice Management Agency. Recently had them on the show. We talked all about fraud and embezzlement. And I was not aware of how big this is impacting the industry and how many teams have to deal with this and docs have to deal with this. So check out that episode. A lot of good advice in there and tips on how to rein that in and discover it. So super excited to have a new guest on the show, longtime friend and contact in the industry. His reputation precedes him. You guys know Dr. Arun Garg. He is a renowned dentist, educator, and author who has built an impressive entrepreneurial track. Beyond founding one of the nation's leading dental continuing education companies, he has successfully scaled businesses ranging from dental clinics and a DSO to restaurants and even a hotel. With decades of experience blending clinical expertise and business acumen, Dr. Garg brings unique insight into what it takes to build, grow, and sustain thriving ventures across multiple industries. Dr. Garg, welcome to the show. Excited to have you on.
Thank you.
Yeah, this will be a fun conversation. You have such a wealth of knowledge and experience in this industry and in entrepreneurship in general. I'm really going to enjoy our conversation.
Hey,
thanks for coming on.
Yeah, thank you.
Yeah, so let's kind of wind the clock back. How did you get into dentistry? And take us on that journey of, okay, I'm a doctor. Now I want to get into CE. I want to get into multi-location, DSO, grow, like all of this. Take us on that journey briefly.
Okay, yeah, it definitely didn't start out like that. And I wasn't one of those that dreamt of dentistry growing up. I wasn't one of those who had family members in dentistry. In fact, quite the contrary, my dad's a physician. So I grew up around medicine. And a lot of times, physicians don't know a lot about dentistry. The one thing he told me is stay away from medicine. He says long hours and weekends and nights. So go into engineering. So I actually, in my undergraduate, did chemical engineering. So I'm a chemical engineer. I realized as I was graduating, this is not my passion. It's not what I want to spend my life doing. And I thought at that time about applying to med school. And my closest friend in undergrad was applying to dental school. And sort of on a lark, I tagged along with them. I took the DETs, did well on them, as applied and went to dental school. And it turned out I enjoyed it. And I came down to Miami and did a residency in Miami. I did my training at University of Florida for undergraduate chemical engineering and for dental school. Came to Miami-Jackson Memorial Hospital for my residency and then joined the faculty there. So I joined the faculty at University of Miami. It's a medical school. There's no dental school, but there's a division of oral maxillofacial surgery. And I became a professor there for 18 years. And
Wow.
I rose through the ranks. It was about 10 faculty members. I was, of course, the most junior one when I joined. And I started at assistant professor level, then quickly got promoted to associate professor and quickly became promoted to full professor. And by the time I left 18 years later, there's only 2 full professors in the department, is myself and Dr. Marks, who was the chairman. And so really kind of steadily rose through the ranks there. And then I decided to leave and went into private practice, which was a huge difference to me. After 18 years where the university hires and fires, and I got huge HR departments. And if there's any legal issue, the huge legal is department. And marketing easy because the whole university and the whole medical is marketing team behind it. So I had to do none of that. All I did was clinical work, a little bit of university politics, of course. I go into private practice in the first 4 or 5 months. Things were great. I already had the reputation. People that did not want to see me in private practice, did not want to see me at the university, came to me in private practice. And so a lot of people very quickly, but I didn't know systems. I didn't know how to is what kind of software to use because that was not a decision I needed to make. Is I didn't know how to hire and fire, and I was atrocious at it. I mean, it was kind of like I
Mm.
go to the grocery store, I see a cashier, you're the cashier here, you can be my cashier. That was
Oh
kind of my
gosh.
mentality. Yeah,
Yeah.
I'm embarrassed to say. And so I learned things through the school of hard
Yeah.
knocks. After 6 months, the practice started crashing. We did phenomenal the first 6 months. Is because people are waiting for me. I'm a fast operator. I do big cases, and so we hit crazy numbers, 600,000 dollars a month that I was collecting. When I left
Wow.
the university, I was earning 50,000 a year as a salary, no opportunity to moonlight, and now I'm doing 500,000 a month, even with overhead. Is I was taking home
Yeah.
about half of that, so literally I was taking out in a week more than $50,000. What I used to take home in a year.
Yeah.
See these billboards, 10x your life. I was literally 52xing my life just by moving
Wow.
12 miles down the road.
Wow.
Then it came crashing down. And I took a lot of courses. I took probably every practice management, practice growth within our industry course out there. A lot of repetition when you take that many courses. 80% of them were similar, but there was always little nuggets I got from each one. And I wouldn't advise anyone to take all of them like I did. That was definitely overkill, but that's just the way I'm wired. And then I took all the courses outside of dentistry that I could find about growth, and so we started climbing out of that. And it didn't climb out immediately. It took time to implement the systems and implement the things and really learn them and really ingrain them. It took about a year and a half, and then we took off. And it's only then that I realized that I had this latent is entrepreneurial is streak that I didn't even know was there. And then after the clinic, I got a second clinic, third clinic, fourth clinic, fifth clinic, sixth clinic, seventh clinic, eighth clinic, and now I'm up to 8 clinics. And was able to is some of them I built de novo, some of them I purchased. So about half of them were purchased. About half of them were built de novo.
You
So
start
it
up
actually
scratch.
gives
Yeah.
me experience. Yeah, if someone asks me, is which should I do? I can actually say the pros and cons, having lived it and gone through it. Here's the pros
Yeah.
of all the de novo. Here's the pros of buying. Here's the negatives of each. I can side by side comparison is them. Um, and then it turned out I had an offer from a DSO to be an equity owner and a this chief clinical officer, and so we've grown that now to 80 offices nationwide, not in 50 states, but is
Yeah.
about half. Okay, about half the states covered.
Yeah.
Our goal is to get that to 300 as the next step as offices. The model for my private practices is all fee for service, all 8 of them. The model for our DSO, where I'm equity and CCO, is primarily PPO, probably is insurance
Okay.
driven, is
Yeah.
different models. So I'm able to compare that as well. Is de
Yeah.
novo practices with purchasing practices with DSO model. And then
Yeah.
along the way is a good friend of mine. He was voted number one chef in America 2019. So he left where he was at before. He was at a Mission Star restaurant. So he and I together opened a restaurant in Miami. Got a Mission Award the following year. Went on to open a second and third restaurant. All of them Mission Awards. Have opened a
Wow.
fourth and fifth restaurant. One of them got top 50 restaurants in America award by New York Times Magazine. One of them by Esquire Magazine was voted top 8 restaurants in America. And then with a different friend of mine, we opened a bakery and was voted James Beard top 8 bakeries in America. So that, yeah, I just went on this entrepreneur
Y-
streak. I bought a hotel that was been in existence for about 30 years on the ocean, 5 acres. Is on the beach in Eleuthera, Bahamas. Um, and I'm just having fun. It's kind of learning
Yeah.
new industries, growing myself, is being able to maybe implement that into conversation or in teachings or for
Yeah.
example, on a podcast like this.
Yeah. And I think also, I don't think we've touched on it yet, but a lot of the industry knows you from your symposiums and continuing education and the trainings that you do to help
Yeah.
dentists place implants
Yeah.
and have confidence in that.
Yeah. As a university
Yeah.
professor, I'm a professional educator. So there I was educating residents and not really students because we went to dental school, so we didn't have dental students, but residents. I was training them, and I was being invited to symposiums around the country, around the world, and lecturing at them. And so I was doing a lot of education for both full-time residents in the hospital. I was doing training for invited guest lectureships, and I was doing about 1 or 2 programs a month when I was at the university. And I would typically do them on the weekends. I could be at the university, of course, Monday through Friday, fly out Friday night, do something on Saturday or Sunday or both, and then fly back and be back for Monday morning. And I kind of joked that if a month went by, I didn't have something like that, I got withdrawal symptoms. I was
Yeah.
like, and so
Yeah.
I usually had 1 or 2 a month is to do that. And about one a month was international. And so I did about 12 international trips and lectures a year
Wow. Yeah.
and probably about 20 domestically. And then when I left the university, I took that same idea and still lecture for other institutions and other associations and et cetera, but started my own and we simply just called it implant seminars. I didn't put my brand or anything about it. Is more recently, you know, folks such as yourself, marketers said, what should we be Garg Institute? So more recently, in the last couple of months, we've started to brand it as Garg Institute.
Okay.
Prior to that, it was simply implant seminars. Um,
Yeah.
and then we trained, and now we're up to, we have a comprehensive program that is, it started out 6 months long. We've now been able to trim it down because people have busy lives to 4 months. Um, Through that comprehensive, what used to be 6 months now is 4 month program, we've trained 20,000 dentists through that. So it
Wow.
is more than anyone in the industry has done with
Yeah.
any dentist. Is have graduate more and is more successful dentists is through that program.
Yeah.
And then what happened after that um, is a lot of these our alumni would say, "Well, I'd like a course on oral sedation." That's not something I do, so I hired the best oral sedation instructors in the country is to come in and do it
Pull that
under
together.
our umbrella, and they
Hmm.
gave that course. Folks asked us about soft tissue surgeries, perio surgeries, crown lengthening surgeries. We hired the best in the country and to do that under our umbrella. Folks asked about Botox and fillers for dentists. That I do some of. So me and we hired the best in the country and is do those courses. And so slowly we went from implants, which is my passion, to now 28 different specialties and subspecialties of dentistry courses. But the main thing behind all of this is all for the GP. That's my mission,
Yeah.
empowering general dentists. So
Yeah.
if it is something, for example, zygomatic implants, that's not our focus. That's not for general
Right.
dentists.
That's too
Okay.
invasive. Yeah.
It is for general dentists expanding their envelope, expanding their scope, is expanding their offerings to patients, is in a way that they can do it easily and predictably and profitably and safely. And so all of these things are things to incorporate into GP practices if they so desire.
Yeah. That's amazing. I want to pick your brain a little bit on that target dentist that you are trying to help and grow them in their services. Obviously, you've accomplished a lot, and you are a driven individual, entrepreneurial, business minded. I think you're unique in the dental space, right? The average dentist out there, we do have entrepreneurial dentists that are wanting to grow, but the average dentist who currently doesn't do implants but is considering it, or even the dentist that started doing this, what's some advice you can give to them to really help them grow their confidence in it, grow their patient base with it, the number of cases they're doing, and level up in that way? What do you see when you're working with dentists? What's a
Well, first
what's something that
let's look
you
at
can
that
help them with?
let's look at that avatar. Um, 10 years ago, is that avatar our the most of the guys in the room were usually between about maybe 40 and 55 years old. That was the typical attendee between 40 and 55 that had 10, 12, 15, 20 years of doing
Yeah,
crowns and bridges, of doing fillings. And now they either were doing it for more profitability or just because they're bored with what they were doing or for new excitement or new adventures and new growth. And that was usually the driving force. And that was kind of is who was taking it. And so there already is a lot of fundamentals with dentistry were already under their belt as and so back then is my curriculum focused on that.
Mm,
Today it is a much younger audience.
mm,
And so
mhm.
instead of 40 to 55 or 60, it is probably closer to between 30 and 45. So a big demographic shift. And with that demographic shift, now we've got to deal with when they come in at 30, number one, is just on the course itself. I mean, they're still in major debt because it's
Yeah,
graduated, is huge
yeah,
debts because that's exploded in this country. And they're coming in younger. They haven't had 20 years in private practice to pay that off. So they got a lot of debt. So we've done in conjunction with that is we have dropped the cost and you go, well, how did you drop the cost? Because you had your expenses. What we did is we condensed the program. And the program when I first was doing it is back then was 11 weekends. So 11 weekends I need
mm,
to rent hotel rooms, and 11 weekends audit visual, 11 weekends of hands-on workshops, etc. I've condensed it down to 8 to 6 to 4. And by condensing it, saving our overhead is trimming it by 65%. We've been able to trim the tuition by 65%
nice,
and yet
nice.
keep the information intact, right? And you go, well,
It's
how do
still
you keep
quality,
the
yeah,
information?
and what they need.
Well, we can still give them the rules, and maybe instead of giving 3 or 4 examples of it, give 1 example of it, right?
Mm,
And so keeping the entire core curriculum, perhaps with just less examples of it. And now what it means is we've been able to slash the tuition by 65% is because we recognize is and they their travel cost gets cut by 65% because is less travel, less
mm,
Ubers, less outside meals, less hotel nights. We offer now the virtual option, so then really trims that down. They still got to
mm,
come at least one time to get all the hands-on workshops, of course, but
right.
is the other sessions. So is we've modified it to really make it easy. And I haven't seen is and now you see when we started this, we were the only ones is training general dentists on implants. At that time, it just wasn't available is implant training for general dentists. Today,
Mm,
it's ubiquitous. You know, there's
yeah,
50 different doctors, guys, institutes,
yeah,
seminars, symposiums offering implant training is out there. But is we've really seen that, well, we've got to make it accessible if there's a desire in that 30 to 45-year-old. And we really aggressively have slashed
mhm,
and sharpened our pencils on it to make it easy for them. And then make it reproducible, you know, is ortho at that time was also not for GPs. It was for orthodontists. And today is who changed that field? Who changed it was Invisalign. It wasn't a person per
yeah,
se,
the
it was
aligners, yeah,
aligners. And that's the way I see myself and have seen myself as to be that guy, not an aligner company, but that guy that has made it okay for GPs. So I've always been there, not just training GPs, but encouraging them and empowering them to say, yes, you can do this. You can do it as good as the surgeons out there. And, and then showing them how they could and show them how to
right.
minimize the complications because they might have more trouble managing complications than a surgeon who's managed
Mm,
complications. Is so we're
yeah,
focusing on trimming the cost, right? Aggressively. We're focused on teaching how to manage or eliminate, minimize is complications, is maximize predictability, is there streamline the workflow in a general dental office is not the workflow intended for a surgical office applied and overlaid on general dental practice, but streamlining is everything for a general dental is practice and teaching
mhm,
from that perspective. So those are some of the things we've done to make it easy.
yeah,
And you go, how should someone get started? You know, there's easy ways. And sometimes we think, well, I've got to make an investment of a course. And even if it's the pricing is 65% discounted from what it used to be, it's still an investment. But there's easier ways. We made a 2-day version. So it's not even 4 weekend, just a 2-day version. And maybe that's enough
yeah,
for you. Maybe it's enough to dip your toe in the water to see.
get some,
Really
yeah,
super, super low investment in terms of tuition, in terms of travel cost, in terms of And
get the exposure, see if this is a fit you want to expand into.
and
Yeah.
if you want even lower, is, we do symposiums, and the symposiums are not in the thousands of dollars. I literally do a 2-day symposium with about one speaker per hour, so about 16 speakers, as you can imagine, world class. I get people like Dr. Marks, who invented the whole hyperbaric oxygen protocol, one of the leading minds in maxillofacial surgery, the guy that developed all the protocol for bisphosphonates, etc. Folks like him, 16 of them, and I do it in exotic, fun places around the country, Hawaii and Miami Beach and Las Vegas, and I make the tuition $99. That's it.
Nice.
$99. And if
Wow.
you put it through the practice and you're able to tax deduct it, then that means if you're in a
Yeah.
40% tax bracket, Uncle Sam is paying $40. It's $60 out of your pocket for the tuition plus
Yeah.
whatever your going flight is. And that's a
That's
vacation
amazing.
destination. So you can make a vacation out of it and make it tax deductible.
That's
That's
amazing.
how easy it is.
Yeah.
$99 tax deductible. You come to a symposium, 16 world class speakers, 15 different vendors to talk to.
Wow.
We made it
We've been
super
the
easy.
sponsor at one of those symposiums and worked with you before like that.
Yes,
They're phenomenal, you guys. You got to
yes.
check them out. In fact, with more and more, let's talk about the industry a little bit. I don't think there's a dentist now when we're doing marketing in different markets that we go to help our clients. If you don't have implants listed as a service on your website or in your repertoire of services that you offer, you're you're missing out on revenue. Not only that, but you're also from a competition standpoint, you're missing out on leveling up in your market so that patients want to come to you. It seems like more and more GP practices and just the regular dentists have that ability now. So if you don't, you're missing out.
There was a slide at the American Dental Association meeting a speaker about 15 years ago, and I was in the back of the room, and he had a slide up that um, if you want to be a quality growing practice, you must offer dental implants. And I was in the
Yeah,
back of the room. This is 15 years ago, and most of the audience heads are going, mm-mm. Because 15 years ago, you could be a growing GP practice and you could be a quality GP practice without offering dental implants. You could do it via as veneers, via crowns and bridges,
yeah,
via
some
a lot of different
cosmetic.
ways.
Yeah,
But today, to be perceived as growing and quality, you almost have to
yeah,
add in some aspect of implants. Maybe the
right,
surgery, maybe the prosthetics, maybe at least the treatment planning, but it's got to be at least some aspect. Today, if a patient comes in and says, you look at them and go, well, Miss Jones, your option is a bridge or a partial, they will say, what about an implant, doc? And
right.
if your response is, nah, 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 they're experimental, or something along
This
those
is not
lines,
good.
and nah, 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 we don't do those, or we don't recommend them, they're going to think in
Yeah,
their head, they're going to make a judgment that maybe he's not up with the times.
yeah,
And so there will be a
yeah,
judgment. Is so you've got to at least do the treatment plan if you want to be growing in quality. Now, if
yeah,
you're not growing,
yeah,
you're at the tail end of your career, you don't want to grow, that's fine. If you don't want to be perceived as quality, that's fine. But at least the treatment planning, even if you don't offer the prosthetics and or the surgery. And most often, as you said, is maybe the prosthetics and the surgery because they're highly profitable.
yeah. So let's transition more to the doc that does implants now. A lot of times, we get doctors that come to us. They may even know you. Hey, I did the doctor training. I can do implants, and I want to grow that. To the practices out there who want more implant cases, let's switch to marketing a little bit. What have you seen? I know you've worked with a lot of marketing companies, ours included. But what is becoming the successful way to get implant patients and grow that part of your practice?
Is pretty much in any industry, is when you're the cutting edge, you have a competitive advantage. And when everyone is doing it, you no longer have a competitive advantage.
Mm.
And so, whether it's early on when you're doing implants and you can charge this fee, and now if everyone's doing it, the fee either
That's
drops that you
yeah,
can charge, or basically it doesn't rise for 20 years and just kind of based on inflation, kind of relatively drops, right? And so,
yeah,
what happens is if you're doing, you know, pay per click, and that's
yeah,
kind of what's called, right? PPC, pay per
yeah,
click, and they click, Does Google charge you $1? They land on your website. Click, dollar, click, dollar, click, dollar, click, dollar. And that was kind of what was said as about $1 is years ago. And
Yeah. Yeah.
even
In
a
the early
marketing
days.
economy. And in small towns, it might be even less. Okay. Today, nobody says $1.
Yeah.
Because
The
the way
competition has raised the prices for
competition,
sure.
because and they were very clever. They didn't simply raise the price. They just did open bid system. And if you say,
Mhm.
I'll bid $1, and then the dentist down the street says, well, I'll bid $1.50, they send him his ad.
Yeah. Yeah.
So then you catch on and say, I'll bid $2, and they send you the ad.
It
And
keeps
then pretty soon
ratcheting up
he
and
catches
ratcheting up.
on and he says, I'll bid 250. And then a
Hmm.
third office opens up down the street and he catches on, he starts at $3.
Yeah.
We've all ratcheted each other up.
Yep.
It is truly like what you see in those TV auctions, which is price.
Yeah.
And now it's gotten to be a place where it is this price. And I don't know the
Yeah.
amount. I mean, you would know those numbers, but it's not
Yeah.
$1. It's $20, $30, $40 for a click. And that's not
Yeah.
even a
Some of them
door.
get really
That's a
expensive.
click.
Yeah.
And then from the click, you got to have the website to grab them. Okay. And
Yeah.
then is
And how are
the
you
website.
differentiating yourself there? Yeah.
And the website cost has now gone up because they got to be more and more and more clever to differentiate yourself. And then if
Yeah.
they do call, now you got a front desk that takes that lead and gets them in. Because between the click cost and because not every click is going to call is
Yeah.
it might have cost you several $100s to get that phone call in.
Yeah.
And
Yep.
so
Yep.
is the office staff number one, do they answer the phone? Right. And we know from our seminar business is we call doctors about they expressed interest. I would like to sign up for the XYZ seminar. We call the office, nobody picks up the phone.
Yeah.
And the
Yeah. The
same guys
front
that
desk
answer on
can be
my
a bottleneck.
class complaining that they're not having enough business. And I think, well, maybe the fact your staff doesn't answer the phone has something to do
Oh
with it.
yeah.
Okay.
That
We see it as you probably do. Is
yeah,
we're not
yeah.
trying to make a research project out of it, but just by the very nature of this side of what I do my seminar is
Yeah.
we're calling dentists all the time
Yeah.
and it's astounding the number of
Oh
them
yeah, for
answer the
sure.
call.
That's
Right.
why we built a call tracking AI system that helps the front desk see how they can do better and when a patient's not scheduling, why they're not scheduling because we saw that disconnect was like, well, hang on, what happened on these 50 calls? Why aren't we seeing the growth? Oh, there's a bottleneck at the front desk that we need to help with. But you're absolutely right. When you speak about marketing costs rising, competition, there's so many different marketers out there now that are encouraging dentists to use online ads, and so those costs are going up. There's a lot of things that we can do to differentiate ourselves and tell the story of why you're different and why you're better and why they should trust you and book that appointment. But yeah, it's an expensive form of marketing, but the revenue is there to support it, and that's why so many practices are going after it. We've built out a process where we can help you with that. If you're listening, we can help you generate those leads, qualify them, get them scheduled, and yeah, our cost per patient now is in the a few $100s to get that patient scheduled for that consultation. But what we're seeing on the back end, if you're doing it right, you see a 9x return on the ad spend. So yeah, there's a lot that goes into adding implants into the practice, as you know. Um, but yeah, this has been a great conversation. We're about out of time. I wish I could keep picking your brain. Let's close with this that golden nugget, right? This is the format of our show. If you could, in all your years of experience in dentistry, DSO, group practice, implants, all of it, what do you think is that one golden nugget, that one epiphany that if our listeners could just have this shift in in their practice, in their life, what would be that thing that would have a ripple effect for them?
It may or may not have a ripple effect for them, but for me, I can tell you, and maybe, and hopefully it does for them, is it's almost like that Nike commercial. Okay. It's about just doing it. When I thought about leaving the university, I thought about it for 2 years until I actually made the move. Okay.
Mm,
I loved my time there. The only regrets I have about my time there is those last 2 years when I was mentally ready to move on. I hadn't physically done it. Okay.
Mm.
And so the things that I delayed on are the things that I have regrets on. So now when something happens, I get the opportunity, I'm excited, I see it, I understand the vision. It doesn't mean I'm, leaping before I look. Okay. But as soon as I've done my due diligence on something, let's do it. Let's implement it, not let me still drag this out.
Yeah. Yeah, I love that.
So that would
I
be
think
it.
of so many things
Operate.
in my life. Yeah, I think of so many things in my life that I wish I had done sooner and taken that risk sooner and tried something sooner. So yeah, just do it. You can always learn to swim and figure it out. And there's plenty of resources, yourself included, of experts that have been where you are that can help lead you down the path. Love that. Thank you, Dr. Garg, for coming on the show. If a listener wants to get in touch with you or learn more about your programs or how they can get your help with any
It's
of
easy.
this, where do we send them?
Yeah, it's easy. I don't know if you can have a link or what, but my website is implantseminars.com. Very simple, very straightforward. And my personal cell number is, and that just comes, directly to me, is
Great.
305-331-6481. I do better with text than actual phone calls. But yeah, either way.
Yeah, we'll put that in the show notes. You guys can text Dr. Garg. He's a great resource. Super nice guy. I've texted him a lot over the years. Um, thank you again, Dr. Garg, for coming on the
Thank you
show.
really for the invitation. I really appreciate it. I love working with you. I love is being on this. Thank you.
Yeah. Well, thank you again, and until next time, everybody on the Marketing 32 Show. Have a great day.